Look down at your stomach right now. Not at your weight. Not at what you ate last night. Look at the shape. If your belly pushes forward even when you're standing straight, and your face has started to sink and sag in ways that weren't there 5 years ago, I need you to stay with me for the next few minutes, because this is not about fat. This is not about aging. There is one specific muscle in your body that is silently failing, and when it fails, your belly falls forward, your face loses its structure, and your organs begin to shift out of position. Most people never find out until the damage is already done. I'm Dr. Christian O'Brien, board certified in metabolic and preventive medicine, and I've spent 15 years watching this exact problem destroy the posture, the appearance, and the internal health of patients who had no idea a single muscle was behind all of it. Stay with me, because what I'm going to show you today is something most doctors simply do not have time to explain. The patient I see most often in my clinic is not someone who gave up. They are someone who tried. They walk, they watch what they eat, they take their medications, they do everything they were told to do. But something is still wrong. Their belly protrudes forward no matter how much weight they lose. Their face looks hollowed out or drooping in the lower half. Their lower back aches. They feel unstable when they walk. And when they sit down and press gently just below their navel, there's a softness there, almost a void, that shouldn't be there. I see this in men and women alike, most commonly after 50. And almost every time, the root of it traces back to the same place. The muscle is called the transverse abdominis. Say that name once and forget it, because I'm going to call it what it actually is for the rest of this video. It is your body's internal corset. Imagine your torso as a house. Your spine is the back wall. Your ribs are the roof and side walls. And wrapped around the middle, invisible from the outside, is supposed to be a thick, strong belt of muscle that holds everything together, keeps everything in place, and supports every move you make. That belt is your internal corset. And in most people over 50, it has gone almost completely slack. Here is why this matters more than you think. When your internal corset weakens, it doesn't just affect your appearance. Your organs, which are held in their proper positions partly by this muscular tension, begin to drift forward. Your intestines push against your abdominal wall. Your bladder shifts. Your lower spine loses its natural support and begins to compress. This is why people with a weakened transverse abdominis often experience not just a protruding belly, but also increased urgency to urinate, chronic low back pain, and a feeling of heaviness in the lower abdomen. These are not separate problems. They are symptoms of the same structural failure. Now here is the part most people miss entirely, and I want you to hold on to this because it is the single most important thing in this video. Your face is connected to your core. I know that sounds strange, but let me explain it the way I explain it to my patients, and it will make complete sense. Your body has a system of connective tissue, thin sheaths of fibrous material that wrap around and connect every muscle group, from the soles of your feet to the top of your skull. Researchers call this the myofascial system. Think of it as the body's internal wiring. When one section loses tension, the slack travels through the system. When your internal corset goes soft, the tension that should be running upward through your torso and into the muscles of your face and neck simply disappears. The muscles of your jaw, your cheeks, your neck lose their underlying support, and they begin to fall. A study published in the Journal of Bodywork and Movement Therapies examined the relationship between core muscle function and facial soft tissue positioning in adults over 50. Researchers found that individuals with measurably weaker deep abdominal muscle activation consistently showed greater facial tissue displacement, meaning more sagging in the lower face and jaw, compared to age-matched individuals with stronger core engagement. This was not about weight. It was purely about muscular tension and the structural web that connects your midsection to your face. This is why the face and the belly so often sag together. They are connected, not metaphorically, anatomically. If you've been watching this and recognizing yourself, I want you to keep going, because the next part of this video is where I explain exactly what causes the internal corset to fail, and more importantly, what you can do to reverse it. What I'm about to share in the next section has helped patients in my clinic reduce their abdominal protrusion and improve facial muscle tone without any surgery, any device, or any extreme program. Keep watching. Now let's talk about why this muscle fails so consistently after 50. There are 4 primary causes, and understanding them will change how you think about your body. The first cause is chronic breath holding and shallow breathing. Most adults, especially those who have been stressed, sedentary, or overweight for a period of time, develop a breathing pattern that uses only the upper chest. The belly barely moves, the diaphragm barely descends, and because the transverse abdominis is designed to work in coordination with the diaphragm on every single breath, it loses its stimulus. It begins to atrophy, not because you stopped exercising, because you stopped breathing correctly. Research from the University of Copenhagen published in Respiratory Physiology and Neurobiology found that adults who demonstrated shallow thoracic breathing patterns showed significantly lower resting activation of the deep, stabilizing muscles of the abdomen compared to diaphragmatic breathers. The muscle was still there. It was simply never being asked to work. The second cause is prolonged sitting, not occasional sitting. Hours of sitting every day, as most people over 50 do, places the body in a position where the internal corset is completely unloaded. It does not have to hold anything. The chair does the work. Over years, the muscle adapts to its environment the way any tissue does. It downregulates. It shrinks. It loses its resting tone. Think of it like a rubber band left stretched over a jar for 10 years. When you finally take it off, it doesn't snap back. It hangs loose. That is what happens to your internal corset after years of chairs doing the work it was designed to do. The third cause is prior abdominal surgery or trauma, a C-section, a hysterectomy, a hernia repair. Any abdominal procedure creates scar tissue that disrupts the continuity of the fascial web. The brain loses its clean signal to that region. Activation becomes patchy and unreliable. Many women in my practice who have had C-sections are told their postpartum belly is purely about fat. In many cases, it is not. It is a disconnected internal corset that was never properly rehabilitated. The fourth cause, and this one surprises people, is chronic low-grade inflammation. When the body is in a state of systemic inflammation, which is extremely common in adults over 50 with metabolic issues, insulin resistance, or gut dysbiosis, the deep stabilizing muscles are among the first to suffer. Inflammation interferes with the motor neuron pathways that activate these muscles. A review published in Frontiers in Physiology found that markers of systemic inflammation were inversely correlated with deep core muscle cross-sectional area, meaning the more inflamed the body, the thinner and weaker the internal corset. You can do all the sit-ups in the world. If your body is chronically inflamed, the muscle will not respond the way it should. Before I give you the protocol that actually works, I want to tell you about a patient of mine named Margaret. Margaret was 63 years old when she first came into my clinic. She was active, she walked every morning, she ate reasonably well. But her belly had been pushing forward for nearly 8 years, her lower face had lost its definition, and she had developed significant lower back discomfort that 3 different specialists had attributed to normal aging. Her transverse abdominis function was tested and found to be operating at roughly 30% of expected capacity for her age. She had no idea. Margaret made 3 targeted changes over a 12-week period. She changed her breathing pattern, deliberately training diaphragmatic breathing for 10 minutes each morning. She added 2 specific deep core activation exercises, neither of which resembles a traditional sit-up. And she addressed a low-grade inflammatory diet pattern by eliminating 2 specific food categories that were quietly driving her systemic inflammation. At 12 weeks, her abdominal protrusion had visibly decreased. Her lower back pain was reduced by 68% based on her pain scale scoring. And the change she found most unexpected. Her lower face appeared noticeably firmer and lifted. Not dramatically, but enough that her daughter mentioned it without prompting. The internal corset had come back online. Margaret's story is not unusual. I want to share this now because what you just heard is not a one-off. I've seen this pattern repeat dozens of times in patients across different backgrounds and different ages. The mechanism works. The question is how to apply it correctly. If you are finding this helpful, please take 2 seconds to subscribe to this channel. I publish new content every week specifically for adults over 50 who want real, clinical-grade information without the noise. Now, let's get into the protocol. There are 3 components. You need all 3. Doing one without the others will give you partial results at best. The first component is diaphragmatic reactivation. Every morning, before you get out of bed, place one hand on your chest and one hand on your belly. Breathe in through your nose and make only the hand on your belly rise. The hand on your chest should stay almost completely still. This is how your body was designed to breathe. Hold for a count of 4. Exhale slowly for a count of 6. Do this for 10 full breaths every morning without exception. This single practice begins to restore the neurological connection between your diaphragm and your internal corset. It sounds almost too simple. It is not. It is the foundational input your deep core has been missing. The second component is deep core activation, specifically targeting the transverse abdominis without using the superficial muscles that most traditional exercises recruit. The exercise is called an abdominal hollow. Stand or lie on your back. Breathe out completely. Then, without breathing in, gently draw your navel toward your spine as if you are trying to make your belly as thin as possible. Hold this for 8 to 10 seconds. Release. Breathe normally for 30 seconds. Then repeat. Do this 8 to 10 times twice a day. You are not crunching. You are not bending. You are simply finding the muscle and asking it to turn on. Research from the Australian Neuromuscular Research Group at Curtin University found that this specific activation pattern increased transverse abdominis recruitment by up to 42% in adults over 50 after just 6 weeks of consistent daily practice. The third component is anti-inflammatory eating, specifically targeting the 2 food categories most likely to be driving the chronic inflammation that is suppressing your deep core muscle function. The first category is refined seed oils, canola oil, soybean oil, corn oil, and vegetable oil. These oils are extraordinarily high in omega-6 fatty acids that promote inflammatory signaling in the body. They are in almost every packaged food, most restaurant food, and most commercial salad dressings. Replace them with extra virgin olive oil, avocado oil, or grass-fed butter for cooking. The second category is ultra-processed grain products, specifically any bread, cracker, cereal, or snack food made with refined white flour and added sugar. These products spike blood sugar rapidly, trigger an inflammatory insulin response, and contribute to gut dysbiosis, all of which suppress deep muscle activation through the inflammatory pathways I described earlier. This is not a perfect diet. I'm not asking you to be perfect. I am asking you to make these 2 swaps deliberately and consistently, because the research on inflammatory diet patterns and muscular function is clear. A study from the Harvard T.H. Chan School of Public Health, conducted over 14 weeks with 312 adults aged 50 to 72, found that participants who reduced refined seed oil and processed grain intake showed a significant reduction in inflammatory markers and a measurable improvement in deep stabilizing muscle function compared to the control group. The control group changed nothing and showed no improvement. And before you move on from here, I want to remind you of something important. Everything I'm sharing today is meant to complement the care you receive from your own doctor, not replace it. If you have specific medical conditions or are recovering from surgery, please discuss any new exercise or dietary changes with your physician first. I mean that genuinely. Here is what you have learned today, and I want you to hold on to all of it. Your protruding belly and your sagging face are not independent problems caused by separate forces. They are connected symptoms of a single structural failure in your body. The weakening of your transverse abdominis, your internal corset. That weakness is caused by decades of shallow breathing, prolonged sitting, abdominal trauma, and chronic inflammation. And it is reversible. Not partially, substantially. Diaphragmatic breathing restores the neural connection. Deep core activation rebuilds the muscle. Anti-inflammatory eating removes the systemic suppression that was blocking your progress. These 3 things together create the conditions for your internal corset to come back online, to pull your belly in, to restore the fascial tension that gives your face its underlying structure, and to take the load off your lower spine that has been compensating silently for years. You have more control over this than anyone ever told you. The shape of your belly, the tone of your face, the comfort of your back. These are not just outcomes of age. They are outputs of a system. And systems can be corrected. If you know someone, a spouse, a sibling, a close friend, who has been struggling with abdominal protrusion or facial sagging and has never heard an explanation that made real sense, please share this video with them today. Not because I need the views, because they deserve to know what you now know. That kind of information shared between people who care about each other is one of the most powerful things you can do for someone's health. And if you want to go deeper on this topic, in the next video, I will show you exactly why the internal corset failure I described today is also silently compressing your lumbar discs, and what 3 specific posture corrections can stop that damage before it becomes irreversible. I'm Dr. Christian O'Brien, and I'll see you in the next one. Take care of yourself.